And over the last 20 years, this is getting wider and wider because more and more sick people have gone and had that done. So that's why we use what's called functional blood chemistry analysis. We use much less forgiving ranges. What's functional, optimal for the body. And I tell you, we pick up a lot of problems that are missed because the lab report says it's normal. But in reality, it's not normal for you. We look at all these at the same time. Why? Think of diagnosing your problem like putting together a puzzle. What makes more sense? Pulling out one piece of the puzzle every 6 months or year, or dumping out the whole box, taking all the puzzle pieces and putting them together. That way we can see the big picture. We don't want to waste months. We don't want to waste years going from doctor to doctor. Each one that looks at you through a little set of blinders and says, okay, here's what I'm good at the GI system, or I'm good at this, or I'm good at that. We want to take a step back and say, what's really going on here? What are the possibilities? That's what we do. I take the time to look for those possibilities and look for the fastest way possible to do this to help end the suffering. And it's worth pointing out, in reality, no other doctor is going to do what I'm describing. They just simply won't. Why? Well, one reason, they don't know that they need to do it. They're using a model that's outdated and just doesn't work for the majority of people. They're not current on the latest scientific research, not research that is done by the drug companies, and certainly don't know how to use a natural supplementation nutrition. The second reason is the insurance companies, and they don't consider this approach to testing medically necessary. And do you know what the definition of medically necessary really is? What's the minimum we can do not to get sued? That's a joke, a terrible joke. The system's broken, and it's no wonder people suffering with immune imbalances, neuropathy, autoimmune conditions have literally no chance in that system. But believe me, after you've seen someone truly desperate suffering with this, and you've seen with your own eyes and heard them tell you how much better they are, how much happier they are, they can go through the day without crying, with the pain and frustration, they're able to put their feet on the ground, get out of bed without the pain, and they thank you for doing what needed to be done, then you know what really medically necessary is. If you only do what your HMO is going to pay for, you're probably going to keep getting the same results you have. I mean, it's harsh news, but you have to hear it. You have to do something different if you want different results. Now, traditional treatment options for peripheral neuropathy come into 3 different categories: medications, nothing, believe it or not, and surgery. Most common treatment option is drug. And all the medication to do really is to try and cover up or improve some of those symptoms. So you've got pain relievers, anti-seizure medications like Topamax, yes, anti-seizure medications because they slow the brain down, which might work a little bit for a while, but it's not really going to help you long term. Antidepressants like Cymbalta are now being prescribed, but not because the person's depressed. Cymbalta monkeys around with your brain chemistry, and some people seems to help out the symptoms. Same thing with Neurontin, a very popular drug right now for people with neuropathy symptoms, but it has the same problems as the rest. The medication will only help while you're taking the medication, and some of these have serious side effects. They do not change or correct what the root of the problem is. They don't correct the underlying problem because no one has looked hard enough to figure out what, or the doctor doesn't believe that there's anything non-drug that you can do for it. The second treatment option is nothing. Of course, nothing doesn't sound very good, but that's exactly what many people do with peripheral neuropathy. Probably because their doctors tried a couple medications and didn't work, and they said, sorry, too bad, you can't do anything for you. But they're dead wrong. Surgery is a third option. Basically, the idea is to release the peripheral nerves, very much like carpal tunnel syndrome surgery. Supposedly, you have a nerve that's being compressed and it just needs to be released. It sounds kind of logical, doesn't it? The problem is just like with carpal tunnel surgery, there's only about 50-50 chance that you're going to get better, but there's a 100% chance that you're going to have some inflammation and scar tissue. My job is not to get you on or off medications. My job is to help your body function the way it's supposed to, so you don't feel the pain, the numbness, the tingling, all those symptoms that you get with your peripheral neuropathy. And all these things that we've described above can be helpful to some degree, but here's the problem. None of these options take into consideration what's causing the symptoms. They don't consider functional disconnection syndrome. They don't even come close to thinking about your parietal lobe. They don't consider the possibilities of an autoimmune attack. They might consider blood sugar and insulin issue, but only if you're diabetic. But even then, they don't think that it can help, at least not without a bunch of drugs. And that's where our treatment program focuses on getting those discrepancies corrected, getting both sides of the brain balanced. So the brain therapy really is a unique way of turning that brain on and making sure both sides are strong, that are participating equally. And how do we do that? Well, how are we going to work your system? We're going to make sure we check the metabolic and neurological components. And now's a good time to say, if you're not willing to make a change, just stop the video right here. Just turn it off, because you're probably not ready for my program. Because if I accept your case, I'm going to be giving you dietary recommendations. I'm going to give you brain-based therapy home style, lifestyle recommendations, specific supplementation based on your metabolic testing. We're going to let you know what exercises to do, if you should do them, when you should do them, and what ones to do. We're going to go over sleep hygiene. We're going to go over biomechanics of daily living and a whole lot more. When you call our office, you're going to get to talk with someone. We call our patients back. We make recommendations based on your blood work and your neurological findings. And I have to tell you, we pick up a lot of things that are missed. If we find a blood sugar or anemia problem, for example, then we have specific things that we can do to address it, nutritionally and dietarily. You're not going to be taking 30 different supplements in here. That's usually way too much for the body to absorb anyway. The brain-based therapy that we do is designed specific areas for your brain that need the stimulation. Now, what are those? It could be auditory stimulation with music specifically designed for your brain, visual stimulation, vibration, kinesthetic exercises, calorics, possibly interactive metronome. There's a whole huge tool chest of things that we can do. And remember, that's designed to flip that switch on in the area, specific area of your brain that needs it. Now, why do I make these videos? It's to get the word out to people just like you that are suffering, that there's still hope out there. It's not your fault. It just isn't. That you've tried the meds, acupuncture, magnets, whatever, and it didn't work. It's not your fault it didn't work. I know you might be scared to try something different, but you have to ask yourself, what's it worth to me to have a normal life again? Imagine what it'd be like to get up in the morning, put both feet on the floor without it hurting, without the pain, or be able to use your hands to do your hobbies, be able to go throughout the day without pain, to have healthy relationships again with family and friends, be able to exercise again, to be yourself again. I mean, you have to ask yourself, what's it worth to me to have a normal life? The number one death for adults 65 years and older is falls. Number one reason for falls is you don't know where your feet are. Now, I can't guarantee results. Nobody can. But my program is comprehensive. And you're going to be proud to tell others that you're seeing us. If we accept your case, we're going to take you under our wing. We're going to teach you about your body. We're going to answer your questions. You're not going to have to run over to Google all the time for every little thing to be answered. And to the degree that you do what we tell you to do is the single biggest factor for your recovery. Now, you may be watching this video from out of state, and we do see several patients from out of state. My program's not sitting out in a waiting room with 30 other people. I know you've been there. You've been to the doctor. You go in, you get to talk for 3 minutes. You get your script, and out the door you go. That's not how we work. We take the time that you deserve. That's why we only accept a few people into our program every month. And you got to look yourself in the mirror and ask yourself, where am I going to be in 5 years? If you haven't already downloaded the paperwork, download it, fill it out, send it into our office. Give our office a call. One of our staff members will get you scheduled for an appointment. I hope I can accept your case. I'll talk to you soon.